Hey, we're back, and I'm your host, BKP. And yes, it's a little cool this morning up here in North Georgia, but beautiful day, so come up this weekend and join us. We're at Circuit World here in Blue Ridge, a little cold. How are you? You're not Dr. Whaley.
No. I'm Dr. Whaley with a haircut. Serious haircut.
It's time for Ask the Doc, and Dr. Whaley is traveling this morning, and we wish him well. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment, and we're glad to have Dr. Ray Tidman with us this morning. How are you, sir?
Good.
Good?
Very good.
You look like you want to say something. What do you...
No, I'm like the Cheshire Cat today. I'm looking forward to the questions.
I'm just happy to be.
Yes.
I stopped and I got my coffee.
Yes.
All right, now I know I don't want to say you got to tell the audience what you sent me this morning. I wouldn't do that, but I thought it was great because I feel that way. So tell the audience.
Well, it's a little background on that because one of my daughters frequent Starbucks, and now we have two Starbucks.
Right.
So one whose name won't go unmentioned was the customer of the week. And they had her name up there. So every time she'd go in, she'd be like all puffed up and everything. Of course, letting her sister know that she was the customer of the week.
This is great.
So the cartoon I sent you was this old fella standing at the Starbucks counter, and one of the girls is saying to the other one, says, "Do we have a drink called cup of coffee?"
So one day I'm standing at one of the coffee places, out of town, not locally, and I run in for a cup of coffee, and I'm listening to this young lady order, and I look over and I'm like, how do you know that? How do you know all these things you wanted in your coffee, and how did you ever do? So obviously she gave me that look of like, who's this old guy talking to me?
Well, see, it could be worse. It's because one of my first times there, as I'm about to check out, the young girl says, "Do you get the senior discount?" I'm like, I know you're trying to be nice and helpful. Do I look like I get the senior discount? Because you're really making me feel old now. So.
Okay, so if you like coffee, if it takes a while for you to order coffee, this is my order. Coffee black, no room for cream and sugar. Move over, get my coffee. There's my order. But I wonder sometimes.
You really stump them.
Yeah. Coffee black, no room for cream and sugar. And I could be at the order and the pickup just like that.
Yeah.
But I listen to them order, and good for them. They enjoy it. Good for them. I'm happy for them. But I tell you what, when they came out with iced coffee, I had to go home and see if I could understand that. But we'll leave it at that. Our coffee discussion.
Yes.
But I appreciate it. He sent me a little cartoon this morning that I thought was humorous because it hit home just a couple of weeks ago when I was trying to order coffee. You want to get to the questions?
Sure.
We probably should.
Let's go.
Okay. So you're not customer of the week?
No.
All right.
have to be down there a lot more than I am to do that. So.
We want to thank Northside Hospital for this segment and Dr. Ray Tidman with us today. Let's see. There is much publicity about testosterone treatment and abuse and state regulations. My father has low testosterone after treatment for colon cancer, and his doctor wants to treat him with testosterone. Is that proper, and what should we know about that treatment?
So this is a cool question, and let's go to the very end of it. Is that proper? In medicine, we try to use medications that are safe and effective. That is it a medicine that's been studied, hopefully in a blinded trial, placebo-controlled, and it's been shown to be, A, to do what it says it's going to do, and B, that it doesn't cause harm. But when you have medicines that are basically based upon natural occurring substances like testosterone, nobody's going to do a trial on that. I mean, we've got testosterone in our bodies. These trials cost billions of dollars. So it's not like you can say, okay, well, let's spend $1 billion to see if this thing that's already in our bodies is effective or safe, because it's safe and it's effective. The question is, what does effective mean?
So your body's producing this.
Yeah, our body produces testosterone.
And it could be low.
It could be low. And, we're all living longer.
Right.
And so it's more and more natural for us to become low in our testosterone.
Actually, that's my current hope. I want to go back. We're all living
That you will live longer.
Yeah, I'm all right. Go
Looking
ahead.
at you.
I didn't mean to interrupt you.
I mean, I can tell looking at you right now, you can at least get through the weekend. So you're
Okay. All right. I'm sorry for the interruption.
I usually save the jokes for the last, but about the
Oh, no,
patient,
you have great material.
the patient that came in and the doctor said, I've got good news and bad news. And the patient said, no, he said, I got bad news and awful news. And the patient said, well, give me the bad news first. And he goes, well, you're going to die in 3 days. And he said, well, doc, what's worse than that? And he said, well, I've been trying to reach you for 2. So.
Okay, so testosterone, our body naturally creates that. It's low,
Right.
so they don't spend a lot of money on a study here.
The study to say,
Right.
okay, well, what is a proper dose? And so what you get are the groups of specialists who come out and they all sit down and they think about it and they come to a consensus about what they think you should get. Maybe they do that, maybe they don't. But in any case, it is an opinion. And physicians may or may not follow those opinions. Some physicians may or may not be aware of it. Some of them may not even have time for it because it's kind of a quality of life issue. Well, it is really a quality of life issue because if you're a man and your testosterone levels have dropped, I mean, it's not just a bedroom issue. I mean, your whole mood becomes sullen. Your outlook is kind of dark sky, just foreboding. Sometimes your ability to problem solve is a little bit slowed. It's a very subtle thing. Ladies, when their estrogens drop, they kind of know it. They get the hot flashes, they get the mood swings, they get all these vasomotor things that their body tells them something ain't right here. Men, they just kind of like creep off this cliff, and it's a tough thing. And it's so slow and so insidious that most of them have no idea they're there. So unless a doctor, A, asks that question, or B, checks a level, and by the way, the levels are humongous. I mean, the levels may be a low normal in some lab of 250 all the way up to 900. Well, that's a big, high thing. But if you lived most of your life at 800 and now you're 300, you're not low, technically, but you're low mentally. So there's all these latitudes of how to treat that. I think the big take-home answer to this question is if you think or if you feel as a man at any age like, well, something's just not right here. I just don't have it. I'm just not with it anymore. I can't problem solve like I used to. I just can't pivot and do things like I used to. Ask the question, is my testosterone low? And ask it from a physician, your physician, your primary physician, who cares about that. Because it's not, you don't want somebody to just blow you off and say, oh yeah, you're 250, you're 251, 250 is low. No, you're symptomatic. If you're symptomatic of low T, then your doctor ought to be addressing that. Now, the safety side of it, if you've got a patient with severe heart disease, then you've got to think a little bit twice about putting them on high testosterone. There are some conflicted numbers there that may say that those people are a little higher risk for stroke and heart attacks. If you've got somebody who's had testicular cancer and or some kinds of prostate cancer, then elevating their testosterone may be problematic. But I had a case one time of a patient who had prostate cancer. He was on the medications that drive your testosterone into the basement. I mean, he's on medicines making his testosterone low as a treatment. And he was suicidally depressed. I mean, tearful, didn't want to get out of bed, miserable. And I called his oncologist and we had a little talk about it. And his oncologist said his depression is more deadly than the chance of reoccurring prostate cancer. Treat him. Get his testosterone level up. So here it is. It's relatively contraindicated, but his other symptoms said, he needs to be treated. So testosterone treatment, male health is becoming more and more of an awareness issue, and testosterone is an important aspect of that.
So let me ask you a question. So you went through, could you do that one more time? Some of the indicators if a man could start seeing, and sometimes in all jokes aside, when you say judgment or processing and things like that is not the same. Like, would you every time, is there an age, like at every time you went to the doctor you would want them to check, or
I guess that's one of the things I'm hinting at, because there are no big societal recommendations. Here's what you need to do.
Right.
Here's the level you treat, and here's when you start checking. It doesn't exist. And the level of awareness in my profession is low. There are a lot of physicians that just don't even bother with it. There are abuses. There are young people who get on testosterone because they're muscling up for some bodybuilding thing. It's inappropriate use of testosterone. There are some people that think that testosterone, you can get it orally, or you can get it over the counter, or you can buy these testosterone boosters. And there are millions of dollars being made on those testosterone boosters. And then, of course, you always leave the fine print, not meant to treat a medical condition. It's all hooey.
So the first part of this question, there is much publicity about testosterone treatment.
Yeah.
If you're low or feel you're low, over the counter.
Yeah, the snake oil salesman, just walk away from that.
Right.
And there's you.
Because it's going to say somewhere on there, not
meant to treat a medical condition.
Right.
Right.
So if you feel you're low, or I guess the signs that you've indicated this morning, talk to your physician.
Talk to your physician. Find out what your level is. Is it relatively low? And would testosterone be right for you? And the other really cool thing about this is that there are new forms of it. Now, this is another place to digress here. Testosterone is a molecule that doesn't get inside of us through our GI tract. Our GI tract digests it. You can't get it in there. Okay? So you have to put it on as a cream or as a shot. And heretofore, the shots were going in the doctor's office, or if your wife was a nurse, having your wife give it to you every couple weeks or every month. And so you'd have these high levels that would drift back down. So you're sawing up and down constantly with your levels.
So if you're taking something, a testosterone supplement, it's not ingesting.
You don't take it as a pill.
Right.
It's got to go through the skin.
Got to go through the skin.
Right. And so there's a new formulation where it's the same old drug, but they've got a little device where you can auto-inject it once a week. And people are scared to death of needles. Well, this thing is a mosquito bite. I mean, you don't feel this needle. You hold the pin against your fat, push this button, count to 6, clicks, and you're done. And you don't even know you're giving yourself a shot. So it's so easy now, and it's a once a week injection, so you can have levels that are very consistent. It's a nice long-acting form of it. It's consistently being given to you, and so you don't have to have the big draw up something, hold up the needle, get a drop. You know what I mean? All that's gone now. Now, it is proprietary. It is pricey. So you've got to have an insurance policy that covers it, and a doctor that's willing to fight with the insurance company to get it prescribed.
All right, thank you very much. That was great information. Okay, Lonnie has twice. You have helped, but I'm not going to be able. I have to have help with pronouncing this word again. I just am not going to be able to get these syllables out appropriately.
Okay. Let me read it.
Well, my husband has
polycythemia.
Polycythemia. I got to keep saying I tried that and I couldn't just.
Poly is many, cythemia is cells.
Cells. My husband has polycythemia, and the doctor thinks it is related to his snoring and sleep issues. How do you make that diagnosis, and is sleep apnea serious?
Well, sleep apnea is serious. Sleep apnea can occur without polycythemia.
What is polycythemia?
So the Latin is poly many, cythemia, so cells in the blood, emia is blood.
Right.
So many red blood cells. Patients who, instead of being anemic, they are super high red blood cells.
Okay.
And those red blood cells are, in this situation, compensatory. That is, the body is making more red blood cells because it's feeling like I don't have enough oxygen running around here, right? So it compensates by making more red
So
blood
if
cells.
if your body gets an indication from you internally,
I need
oxygen
more blood
level,
up here.
you know,
Yeah, and so that's the it's a subtle thing that if I had a patient come in and they don't appear to be, they don't have the classic sleep apnea look, whatever that is, but if they come in and everything's fine except the red blood cell count is high, then I should ask the question as a physician, well, maybe they've got sleep apnea. So then I'll say, if their wife is there, does he snore? Does he stop breathing? Do you have to jar him at night? Or if the wife's not there, and this could be vice versa. The women get this also. So the husband could report on the wife. Similarly, do you feel tired when you wake up? Do you find you have to take a nap during the day? What are your energy levels like? How are you doing? And those patients that are sleep apneic are not resting well, and their breathing cycles get down cycled, and they are not delivering the oxygen to their brain. So therefore, the body, in a compensatory fashion, makes more red blood cells trying to get more blood up there. That's the polycythemia side of it. So back to the whole issue of sleep apnea. Now, more and more people are talking about this, and it is a major issue. If you're having trouble with your weight, if you're having trouble with your blood pressure, if you're having trouble with wakefulness, falling asleep while you're driving, or having to go take a nap, those are all the quintessential markers for sleep apnea. It's a major problem, and we put on a little extra weight. Our airways tend to want to close at night from that weight. Then we are just basically not ventilating. Our body's not moving enough oxygen.
okay. So, because see, I wonder. I mean, I think when you have a long day and you got things you have to do in the evening and you get up early, I think like there's nothing wrong with being tired in the afternoon, because it should be normal as you've got a lot of hours in, and you take a little nap, and it's what I'm saying. So, but I have to say, when I get up, or myself personally, I don't know. I think a lot of people get up, they don't know if they slept well last night.
Right.
You know what I'm saying?
Yeah. And there's some people that's the way they are. I mean, there's some people I joke around. They're like a farmer. I mean, it's like 5 o'clock, their eyes come open, they're ready to go. Like I need to get out there, get the chickens fed, get the tractor going. They're just moving, and that's the way they're built. And there are other people, they're groggy in the morning. They're quote not morning people, and they've been that way their whole life. Well, it's hard to tell with those folks. But most people know themselves, know their bodies, and they if they look back, they can say, well, I'm not what I used to be, and and it's not just a matter of being a decade older here. I really got to go take a nap, or I look forward to that nap. Now there's nothing wrong with a nap. I think a big fat nap is a great thing in life.
I love it.
So
I don't argue with.
Don't hear me on that. I'm not putting naps down at all. I'm just saying, if your life has changed and you have to take a nap and you're not functioning like you used to, get this tested. Now, one of the other nice things about this, and I always harp on technology and how we're improving things. The screening is so much easier now. I mean, the doctor orders a home test. You go pick it up, you take it home, you put a couple of leads on your chest that monitors your heart, put a little lead on your finger, you have a little strap that goes around your chest that looks at your breathing, and it records overnight at home in your bed. So you're at home, okay? And then a report is generated from that, and the doctor can, at that level, see, is that person stopping breathing, and are their oxygen levels dropping? And if those two things show up on the test, then you need further testing. But you can find out from a lot of people with fairly good ease, is this a problem or not? So the level of testing now is pretty slick.
I can't wait to get up in the morning, because I love this opportunity. I love the opportunity every day of getting another shot at this thing called life. So I'm one of those, my eyes open up in the morning, I'm ready to go. So wow, I get another shot at this, and then Monday I have no trouble with Monday. I get to go back to work. I know it's strange, I understand, but I get to go do it again. I understand.
You remind me of that motto.
I trust me. I've been told things from people.
Well, what I always say, it's better to be seen than viewed.
Well, I'll tell you what. When you're like on the weekends, then On the weekends, like sometimes I'll get up early and then I'll say something to somebody and I'll say, "What's wrong?" And they'll say, "You're talking to me."
It's not a morning person.
There's nothing wrong. You're just talking to me. So we'll leave it at that. I appreciate you coming on and doing this and filling in for the good Dr. Whaley. Anything I know a lot of times. Well, we just had the first question surrounded men's health, but a lot of times when you come in, you like to, before we leave, any advancements, anything going on with men's health or something like that, or anything you want to make sure the audience knows. Is there anything this morning you'd like to share before?
Just the general statement that if you feel like something has changed drastically in your life, particularly for guys, I treat guys a little bit differently. I'm developing this theory in my head that we're hardwired to think that we're 20 years old our entire life.
Uh-huh.
Yeah, I can go out in that garden and I'm maybe 80, but I can work for 8 hours.
I got it.
No, that ain't you know.
No.
Or I can get on that bicycle and I can ride 20 miles an hour for 5 miles. I did that when I was 20. I can do that when I'm 60. So there's something about us guys that we don't get that. So for men, if you feel like something has changed, you got a good wife, she's going to drag you into the doctor's office. Sometimes you got to drag yourself in there, or you got to at least say, "Okay, I'll go," and ask the question. None of them are dumb questions. They're all good questions, and a good doctor will help you start tracking it down.
I appreciate it. Well, now, did you have you used up all your material, or did you say?
I'm a week late.
Earlier. I mean, you're already. You already announced to the audience. It looks like I can make it through the weekend, so
Yeah.
I feel good about that. I'm not gonna buy green bananas right now.
Yeah,
but
that's right. That's when your
your
doctor says that, you're in trouble.
Yeah.
So, this one's a Halloween joke. I guess I can tell a Halloween joke.
Sure, why not?
I got it from one of the kids. It's a medical joke. Why is Dracula vegetarian?
I don't know.
He heard steaks were bad for your heart.
All right. We'll leave it at that. It's always good. It's always good to have Dr. Raymond Tidman with us here on Ask the Doc. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. We want to wish Dr. Whaley well as he's traveling and welcome him back soon. If you would like to send a question to the doctor, please just email us info, I-N-F-O, at fetchyournews.com. Put in the subject line, Ask the Doc, and we'll get it to Dr. Whaley. Also, don't forget, these segments are all uploaded on our YouTube channel, FYN TV, Fetch Your News. All right. Under the playlist, click on playlist. That's simple. And you'll see Ask the Doc. So a lot of these questions that we have, you might want to share with family and friends or watch again. So we're going to take a brief break. Again, Dr. Tidman, thank you very much. We're going to take a brief break. And when we come back, it'll be time for the All-Star Political Panel. And what do I always say, like a broken record? I wonder if we have anything to talk about. Take us to break.